I'm not going to subject you to any more PowerPoint slides, but if I was, I would borrow the one that was in the middle of David's presentation. It was a lovely slide with the two sides of the brain that I think that we could all see us, hopefully we could all see ourselves in, with the one side with its compartments of hard evidence, and then the other side, which is, as a cultural anthropologist, where I've lived for almost all of my life, which is the one that's populated with people sitting on little green hills and surrounded by flowers and getting in touch with emotions, I think is what we were looking at. So,
I can't get it on. Sorry.
Don't worry about it, it's down there, it's number 6. Now, where does the real people side to this fit in? I think that there's some very important things that Keith was pointing out at the beginning about the DHP approach to things and the kind of operation that Keith has been busy putting together and building the foundations of. And then moving on to the things that David was referring to, the actual business of data, the actual business of information. And I think that our approach to the notion of training is really trying to bring these things together. Because Keith and I have developed a kind of way of working over the years, which is that what we're genuinely interested in is people who work in information-rich places. They work in workplaces, in environments, they run organizations that actually generate large amounts of information. Sometimes because they go out of their way to generate large amounts of information, and sometimes because they're just doing their day job. And therefore they're building up all sorts of data, all sorts of information about the kinds of things that their organizations do. Now this image of a place, or a virtual place, where people are coming together and they're constantly trying to do the thing that they're being paid for. They're trying to do the thing that's going to make the shareholders a profit if they're in private business. They're trying to do the things that they've been told to do and meet all the policy implications if they're in the public sector. And of course, they're trying to provide the services that they've been commissioned to provide if they're in the third sector and the social enterprise sector. And all of those things that they're involved with are about juggling the information and the data that they're presented with, partly by just the doing of their normal day job and the running of their organisation, and partly by operations which go out of their way to generate data. That the goal of an exercise is literally to generate data. Keith was referring to discovery interviews, the kind of qualitative patient journey, for those of you who aren't in the know, the qualitative patient journey interviews which many NHS trusts up and down the country are trying to use to begin to take steps to see the world of healthcare through the eyes of the users of healthcare, through the eyes of the client, if you prefer that terminology. Now, that would be a classic example of an organisation that is, although it already exists in a world that's fantastically wealthy in information, is taking steps to go out of its way to produce huge volumes of a new and different type of information. And our approach to the idea of training really starts with that picture. Because what we're really trying to suggest is that when we want to put together training packages for people, when we want to present a menu of training opportunities, for example, that you'll find on the website at the moment, then what we're really not saying is that send us somebody for 3 hours and we're going to teach them to be a total expert in qualitative research methods. Or send somebody to spend 3 hours of a workshop with us and they're going to leave as somebody who's got the same knowledge as a member of, or a senior member or fellow of the Royal Statistical Society. Because we're not claiming to be that kind of magicians that can take the people who work for an organisation, whether it's a pharmaceutical company, whether it's an NHS trust, whether it's a third sector or voluntary sector organisation, social enterprise, and to take the people who work for that organisation and in a very brief time turn them into technical experts in the nooks, crannies and nuances of every single data and research method that exists. Because we actually don't think that's possible. We think that people who are claiming to do that are actually kind of trading on some kind of false banner. But what's much, much more useful to do, of course, is to spend time with people and develop their skills in knowing where data comes from, knowing the ways that data is generated, and knowing the ways that data can be analysed or crucially interpreted and then fed into decision-making processes. In other words, to genuinely live in the area where data doesn't produce knowledge, it produces information. It produces information which then produces evidence. And that really is what we're all involved with. That we're interested in the generation of knowledge which is then usable in the decision-making process, which I think is a reasonable working definition of the idea of evidence. It's not knowledge for its own sake, it's knowledge that can be integrated into a set of decisions which will then be checked up on by another application of research type or audit type activity. Now, if we are working in that area, then we're going to be using techniques, we're going to be using people who do techniques on our behalf, we're going to be using all sorts of kind of geeky experts. And the person who works, whether they work as a manager or whether they work as a kind of regional director or whether they're the boss of the whole organisation, is certainly not going to become a geeky expert in every nook and cranny of the geeky world of data production and data management, data quality, data analysis and data presentation. What they've got to have is a genuinely kind of holistic big picture of what's going on, of the ways that information are being produced and the uses that they can be put to. Now, purely by misfortune, I spent, not my own personal misfortune, but my teenage daughter's personal misfortune, I spent 3 hours this morning in an accident and emergency unit and only just made it here just before we started. And while I was sitting there waiting for my daughter going to have an x-ray and going to get sutures put into a mystery wound, then, which I still haven't got to the bottom of, I've got a horrible feeling it might involve half a bottle of vodka, but that is going to have to wait for the discovery interview phase, which I can assure you will be taking place later on today. But then I was able to observe all of the different people who are in the Colchester General Hospital Accident and Emergency Department at the early hours of a kind of weekday morning. And it's extraordinary. You can see the data piling up in front of you. You've got people from the cleaning agency, Carillion, who are commissioned by that particular hospital trust. And so they're dealing with the kind of front of house, they're dealing with the mopping, and they're dealing with the loos and the door kind of operation, etc. They're clocking in, they've got a supervisor who they're handing in forms that they've done this or they haven't done that or whatever it is, and that's kind of burbling away at a desk in the corner. You've obviously got the reception staff with their kind of computer screens, and they're booking people in, and they've got some data about them. You know, what's your postcode? Right, yes, we can know who you are, but we've got to check that, etc. You've got all the different sorts of clinical people around, and of course, last but not least, although it sometimes feels least, you've got the clients and the users, etc. Now, in many ways, what we were looking at, what I was looking at this morning, was a kind of microcosm of all the things that we're interested in. Because there was so much data flying around that room and being generated in that complex of rooms. Some of it strictly belonging to one side of David's slide. It's strict outcome measures. It's bums on seats measures even before it's outcome measures. The number of people who came in, how old were they, whatever. Hard data, if you like to look at it that way.